Having stubborn pockets of fat around your stomach, your love handles, bra lines, inner thighs, arms is something that a lot of us are struggling with. This is not easy to lose. Those pockets of fat are actually very challenging. Even when you're watching your diet, exercising, and you're doing your best, you might notice that these pockets of fat are very stubborn and they are still there. The reason why these pockets of fat are not moving at all is there is a lot of factors, mostly hormonal factors, that is contributing to why we have these pockets of fat. It's not just about weight gain. And you might also notice that even if you're not big, you still have these pockets of fat that really bothers you so much and you wish you can't get rid of them. I'm here to talk to you about the PCDC or the lipolysis injection. And if you haven't seen me before, my name is Dr. Maureen Apshay. I am a certified family physician in Ontario, Canada. I've been doing cosmetic and non-surgical treatments for a couple of years now, and I've been working as a family physician for over a decade. So let's talk about the medical options we have for you. I want to give you more details about what the PCDC injection is. PCDC stands for phosphatidylcholine and deoxycholic acid. Those are two natural ingredients that we naturally have in our body, and those products are mostly responsible for breaking down the fat cells. Mostly when we eat and digest the fatty food, your liver is processing deoxycholic acid. It will be released from your gallbladder. Deoxycholic acid usually fights with the fat cells to break them down. And once we break down the fat, we will be able to digest them. So we basically take them in a very concentrated form. And when we take them in a vial, we're able to take the advantage of these medications being able to break down the fat cells, and we simply inject it in the areas that has the unwanted fat. It can be your stomach area, it can be your thighs. If you have cellulite, it can be a perfect choice for you. Same as the arms, basically even the double chin area. Basically, any area that has unwanted fat can be a perfect area to be injected. These injections are definitely has to be under medical supervision. Not everybody is a candidate. Before we do these injections here at Revive Medical Clinic, we always do a very thorough consultation. We want to ask you about what medications you take, general health, any medical conditions you might have, pregnancy, breastfeeding are definitely contraindications. So we have to have a thorough medical consultation with you first to make sure that this is your best choice. The reason why I love the fat loss treatments is so many factors. First of all, when we break down the fat, this is permanent reduction for the fat cells, which is an amazing way to get rid of the fat cells. It's minimally invasive, pain-wise is very tolerable. I personally had this injection before and I found it was very easy for me to tolerate it. Another great advantage of the loss treatments is every time we put on weight, we are building more fat cells. So over the years, we end up with so many fat cells that are filled with fat. When we try to lose the weight, the fat cell don't break down. The fat cell actually is just shrinking, and the amount of fat in the fat cell will get less. The minute we stop dieting and the minute we stop watching our diet or the minute we put on any weight, the fat cell will swell up again. What that will do is we will always be in this weight loss, put on weight, and changing our clothes size, which is not a good idea. With the fat loss, what we do is we permanently get rid of the fat cell. So instead of us having so many fat cells, we're actually losing some of them. So even if you put on the weight in the future, you're not dealing with the same number of fat cells like before. You already lost a lot of the fat cells based on these injections. What happens is when we inject the PCDC into the fat cells directly, that will break down the fat, your body will be able to flush it out and that will go out with your urine. This is why we advise you to drink lots of water after these injections. So, who is the perfect candidate for this treatment? Basically, anyone who is already watching their diet, already exercising, they are doing their best, and they still have these stubborn pockets of fat can benefit a lot from these treatments. I also want you to know that there is a big difference between fat loss and weight loss. At Revive Medical Clinic here, we help you with both. But what we're talking about now is not going to really reflect on how many pounds you weigh when you step on your scale. because fat is actually very light. So when you lose the fat, it doesn't really reflect so much on the scale as much as it reflects on your measurements. It reflects on how many inches you measure. It reflects on your clothes and how the clothes fit, which I guess this can be an important cosmetic concern for so many of us. But it doesn't really reflect so much on how much you weigh. If you need help with both, we will definitely be more than happy to help you with both. I also love to combine the injections with other treatments that will complement what we're doing here with the PCDC injection. So we do lots of injections that will help to cleanse your body and target the other type of fat that we all have, which is even more serious than the superficial fat, which is called the visceral fat. The visceral fat is the fat that is deep inside our stomach. It's covering our organs, it's pushing on our blood vessels, it's affecting our organs function, our liver function, our kidney, heart. We definitely want to get rid of those visceral fat. So that lipolysis injection, of course, does not help with that because it does not go that deep. However, we have other injections like glutathione, for example, that will help to break down the fat from the body generally, especially it targets the visceral fat and it helps to cleanse and detox your liver in particular, which will help you to have a healthier life. Keep in mind that we have a link now between the amount of visceral fat we have and the longevity, which is how many years we will live. And the more visceral fat you have, the less years, unfortunately, you can live. So if you can get rid of those visceral fat by some injections and maybe some IVs, that will help you not just to live longer, but also to live healthier. So it's great when we combine the lipolysis injection with other treatments, not just the injection to help to cleanse your body and break down the fat even from your blood vessels, but keep in mind that when we talk about lipolysis, we melt the fat from the unwanted areas. But as much as this treatment is very effective, but it does not tighten the skin. So once you have a couple of sessions, like usually after 3 or maximum 4 sessions, you definitely notice a major improvement in the amount of fat you have and you lose a couple of inches. Then we need to go to the next step, which is tightening the skin. This is why for the best results, I love to combine the injections with treatment like radio frequency or laser, because once we lose the fat, we definitely want to tighten the skin for everything to look its best. We were able to help a lot of clients through their weight loss and fat loss journey, and we have lots of examples to share with you. Yesterday, I had somebody who was here at the clinic, and she was telling me that so far she already lost 24 pounds since she joined the program a few months ago, and she lost over 5 inches from her waist on its own. She was super happy. She was doing more shopping now for her new size, and she was going to her cottage. She's enjoying her summer with the new shorts. It boosted her confidence so much. Everybody was complimenting how she looks. And most importantly, she knows that she was able to minimize her risk of having chronic medical conditions like diabetes, high blood pressure, heart problems. She was able to minimize her risk for having breast cancer, colon cancer, and other cancer that can be directly linked to being overweight. If you still need help with the weight loss or with the fat loss, please don't hesitate to give us a call. We would love to help you through your journey under medical supervision.